Today's episode is brought to you by my top resource for women's health professionals, How to Interpret Virtually Any Chart Your Client Throws at You. Our new ebook breaks down complex chart interpretation into an easy step-by-step process. Head over to fertilityfriday.com/chart to snag your complimentary copy today. That's fertilityfriday.com/chart.
This is the Fertility Friday podcast, episode number 501. Today's episode is all about chart interpretation. We're going to go into what some of the most common mistakes are when you're jumping into interpreting menstrual cycle charts and some of the key strategies that help to make it a lot easier. So without further ado, let's go ahead and jump right in. It's hard to believe that it is the end of 2023. This is the last episode of 2023. And I was thinking about how I want to finish out the year. And I thought, what better way than to talk about chart interpretation? This is a topic that has come up so much this year. It's something that I'm always talking about with my FAMM practitioners. And we just created an incredible new resource for women's health professionals, how to interpret virtually any chart your client throws at you. And so I thought this would be a great opportunity to dive into some of the tips and tricks and strategies that have helped me to increase my confidence and ability to interpret virtually any chart that my clients share with me. And so, what better way to close out 2023 than to help you feel more confident about the way that you're interpreting, whether it's your own charts or your clients' charts or a combination of both. And if you are really keen to dive deeper into this topic and you're already intrigued, make sure to grab a copy of our complimentary ebook, How to Interpret Virtually Any Chart Your Client Throws at You. And you can grab your copy over at fertilityfriday.com/chart. So I want to start with some of the common charting interpretation mistakes that I think are really, really common. And I think that perhaps it comes from whether it's a lack of experience or kind of like an overexcitement or exuberance. And so I think one of the most common chart interpretation mistakes that practitioners make, especially when they're starting to interpret their clients' charts and looking at a variety of charts for the first time, I would say the biggest thing is just taking it for face value and jumping to conclusions about what you're seeing. So especially if you've been a listener of the podcast for a while, you've certainly heard me talk about how the menstrual cycle is a vital sign and how we can learn so much from paying attention to the menstrual cycle charts. And that is absolutely true. I would say, however, when you're looking at a menstrual cycle chart that somebody shares with you, or if you've ever been in one of those forums online and people are just throwing up charts, we often really want to just look at the chart by itself and then be able to make a whole bunch of conclusions. And we want to be able to know exactly what's going on. And what's interesting about chart interpretation is you could have a very similar looking chart, let's say from 3 different people. So I wouldn't say that anyone's chart looks exactly the same, but let's say that you're looking at the menstrual cycle charts of 3 different people and they could look very similar. And you could literally have 3 completely different scenarios that are causing whatever it is that you're seeing there. And so that I would say is the biggest challenge. And this is certainly a challenge for me as well, because I often have whether it's DMs or messages with the charts, and it's kind of like, what's going on here? But without the proper context, background, intake information, then it's really hard to just, it's not hard to throw up some suggestions, like what could it be? Well, it could be this, it could be that, it could be this. But is that helpful when it could be completely off if we don't know the context of the situation? So what do we do about that? What do we do about that big challenge? So from the practitioner standpoint, that means that before we start jumping to conclusions about what we're looking at, we have to do a bit of investigation. So if you're working with clients, before you run to interpret their chart and even tell them something, oh, you must be this thing. And then now you've given them potentially a diagnosis and you're not a medical professional, so you shouldn't be doing that. You shouldn't be giving people diagnoses. And then also now you have this idea in their head and it could just be something completely different. And then if you take it a step further, you could even be telling them to take this thing or to do that thing or take this supplement. And really, we haven't even figured out what is on the chart yet. So that's a pretty significant mistake. And I think that it's pretty common as well, until you get the proper training and experience to be able to kind of really look a bit deeper into it. So what do we do about this? I would say the first thing we need to do is we need to get our clients charting in a standardized way. So this is something that I do with all of my clients. With fertility awareness, we often hear those words like, fertility awareness method, and we kind of assume that there's this unified thing called the fertility awareness method that everybody agrees upon. But when you dive into the fertility awareness world, you discover that there's a lot of different ways to chart your main fertile signs. So for example, taking charge of your fertility was my first resource, learning to chart. And for many of you, it may have been your entranceway into this world of charting. And in taking charge of your fertility, for example, when they're looking at cervical, when Tony is sharing about cervical mucus charting, she's often sharing a method of internal checking and talking about it in a specific way. Whereas if you were to look at, let's say, the Billings method, they are looking at cervical mucus checking in a different way. They're not doing internal checking, more of a how does it feel throughout the day, if you feel a feeling of wetness, that kind of thing. If you look at charting through the Cretan method or the Justice method, they're doing an external wiping option where they're looking at more so how the toilet paper feels as you're wiping throughout the day, not just how it feels in general and not necessarily through internal checking. And then you have methods like the Marquette method, which cervical mucus checking would be completely optional in that method. And they're actually looking at biomarkers. So they're looking at the urinary metabolites of how we're processing estrogen. So they're actually doing a urine test and then identifying the fertile window based on when you start to show those signs of estrogen to indicate that you're moving into the fertile window. So just with those examples, hopefully you can start to see that, within the fertility awareness world, there's a lot of different ways to get at the same thing. What are we trying to get at when we're looking at cervical mucus? Whether we're checking internally, externally, or looking at hormonal biomarkers, well, we're trying to identify when the fertile window opens and then when it closes. And that corresponds to when we start to see our cervical mucus observations. That corresponds to when we're seeing those urinary estrogen metabolites. And so there's different ways to do it. And with that said, when you're working with a client who's charting, until you've had that conversation, you don't really know how they learn to chart or what method they're using, if they're self-taught or if they took a class, and how that all works. And for those of you who have done some chart interpretation, if your clients have brought to you a variety of different charts from different methods, then you may have already experienced this when you see a chart that looks different to the one you're used to. And you look at it and you kind of don't even, know what it all means. And you have to kind of ask them, well, what's this thing? And what's that thing? I've never seen that before. So the first thing that I do with my clients when we are getting into the chart interpretation conversation is I actually am teaching them how to chart in a specific way so that we can all be on the same page and we can get into charting in a standardized way. And this is, I would say, one of the most important steps to correct chart interpretation. And it doesn't mean that you can't use their current charts or their past charts to help you identify what's going on. But it does mean that there is a limit to how much information you can gather when your client is charting in their own way. So for those of you who've been longtime listeners, you've heard me say that when I'm encouraging my clients to take their temperature, I talk about the 10-minute rule. And so that involves holding the thermometer in place for 10 minutes. And it's funny because for some people, it really pisses them off. This is crazy. This couldn't work and all that kind of stuff. But from years of being in the field, and you can certainly try it yourself, when you hold that thermometer for 10 minutes, you actually can see for yourself. Not every single person, but the vast majority of clients of mine who have tried this will find that it actually makes a difference. It helps the temperatures to be more stable. And whether or not it makes a difference for you personally, if you are teaching clients, if you are working with other humans who are also charting, then it makes a massive difference to have that as a standardized method. Because I recognize that there are individual differences and there are women who say, well, if I take my temperature right away versus if I hold it for 10 minutes, it doesn't make a difference in my chart. But if you're working with 10 people, 15 people, 20 people, 50 people, 100 people over the course of time, you will find that having a standardized way of doing it makes it easier for the vast majority of your clients, makes it easier for you, and it really helps to rule out some of the issues. So this is one of the things that's really interesting about having a standardized charting system, especially when you're working with clients, because regardless of what works for you personally, you want to make sure that you're creating a container so that your clients can succeed, because everybody is different and without a standardized way of doing it. So even if I give an example, I have some clients who, when they're taking their temperature in the morning, if they get up and walk around, it'll make a huge difference on their chart, and others, it won't make that big of a difference. Some clients will drink a glass of wine and the temperature goes all the way up, and it's, almost laughable how big of a difference it is, whereas others could drink wine all night and it doesn't make as big of a difference. So there is individual differences there, and ultimately we want to have a system where we can put everyone in there, and it really helps to better interpret. So that's just one example with the temperature. With the cervical mucus charting, if you're charting in different ways, whether it's internal checking versus external checking, that can make a big difference in terms of how frequently you're noting your observations, how much mucus is showing up on the chart, and whether or not you're even interpreting what's happening. Is it really mucus or is it vaginal moisture? And so these are things that are going to make a difference. Because let's say you have a client who has cervical mucus every day and they're noting that. So if it's a true kind of quote, mucus or discharge every single day, that could be a sign of an infection. It could mean that they have yeast, or even a sign of abnormal cervical cells is having a frequent discharge. That's happening all the time, even outside of the fertile window. But if you have a client who's, let's say, checking internally, and that's what they're noting every day, the vaginal moisture, then you could be making assumptions about what's going on in their chart, but not really being clear on what is actually happening. The first step is then to educate your client, put everybody on the same page, make sure we have a standardized way of doing things. And then the second step would be to see what happens. Now that we are charting correctly, then we can get our baseline charts, what I always call it, and see what's really going on. And so what this means is that in the process of chart interpretation, the more deep, nuanced chart interpretation doesn't start when your client throws up a chart the very first time. That is what opens the conversation, that first chart. But then we have your first chart together. And that is when we really start to see more of what's really going on. It can be extremely eye-opening to start this process and to see the difference between the charts that your client may have brought before versus the charts that you now have together. Especially if you do have training in a specific method and you're able to kind of go a little bit deeper into what's happening with mucus and with temperature and potentially even cervical position, or adding in other biomarkers like ovulation test strips or things like that, then you can really get a much greater sense. And it's interesting because sometimes you'll have a client who has a lot of charting experience where they've charted already for several months or even a year, but when they're charting with you now under your wing, assuming that you're trained and you have a background in charting and you can help them to really get into that nuanced way of charting, you can gather so much more information. So I think going back to the most common mistake, from my opinion, about interpreting charts would be that we're going to go in and provide all of this explanation before we really know what's going on. And I think that's one of the things that I'm always trying to shed awareness on and shed light on, to kind of get away from like, oh, I saw spotting today, what does it mean? Because sometimes we are able to ascertain what that can mean when we have enough information. But when I'm thrown something like that out of the blue and I don't know the client's history or what's going on or how they're charting, I'm often reluctant to provide any type of information because ultimately we have to put it all into context. So another key piece of chart interpretation is starting off by knowing what's normal and what's abnormal. Especially when it comes to menstrual cycle charting, I think there's a lot of different factors that come into play. So my personal thought is that women who are attracted to menstrual cycle charting, who gravitate to it, we tend to be a little bit type A. I feel like I can say that. I often say that because this is something that we're choosing to do. We're choosing to put our menstrual cycle under a microscope. We're choosing to track fluids that are coming out of our body. We're choosing to note our temperatures, right? We're choosing to do this very kind of nitpicky, very specific type of information, cycle tracking, right? And this doesn't mean it's difficult. It's not. I'm not trying to say, because it's not. It's like brushing your teeth, when you get into a routine, it's fairly straightforward. So that's not my point. But my point is just that it is a very detail-oriented type of activity when you're really in the weeds with charting. And so what can happen when you start to really look at your chart under a microscope is you can start to see problems everywhere and start to think that everything is a really big problem. And so this is one of the things that I work with clients and my practitioners, which is finding this balance, because we're taking this extremely detailed, the method that I'm teaching, right? It's extremely detailed. We go into the weeds with a ton of notations for cervical mucus. We have these rules for, base body temperature charting to help us interpret better in situations where the temperatures may be a bit more unclear. And so there's all these different rules. We can really put everything under a microscope, and that can leave us a little bit, too critical, I would say, looking for problems everywhere, to the point where if the temperature is a little higher today, we're thinking, oh my gosh, why is this happening? And so the key is to hold these two realities where we want to get the detail so that we can accurately interpret what's happening in the chart. And we want that level of detail so that not only can we tell which days are fertile or not, but potentially identify underlying issues, see signs of different health issues that could be showing up. So we do want that detail. But on the other hand, we don't want to drive ourselves nuts by looking at every possible thing as an issue. So the most important piece is to know what's normal versus what's not normal so that we can start to find a balance. This does come with experience. It's a little bit more challenging right off the bat. And one of the things I often say to my clients and practitioners too is that if you are charting, so let's say that you as a listener right now have been charting for a little while. Let's say you've been charting for 3 months. So if you've been charting for 3 months, and let's say your cycles are pretty average, so let's say 3 months is about 3 cycles, then the 3 cycles make up 100% of your charting experience. So if you have one of those 3 where something's weird, then that makes up a huge percentage of your experience. And so of course it feels like this really, really big deal. But someone like myself, who's been charting for over 20 years, I've had hundreds of charts of my own at this point. And so when there's one chart that's a little weird, it's the tiny blip on the radar. And so I can look at that chart in context and actually not get freaked out by if there's something odd. So, I can share that this year I had, a variety of different stressful experiences, some for positive reasons, some for challenging reasons, but it was certainly an interesting year. And so between having, let's say, a young baby, my daughter is now, she is 17 months old, so she will be 18 months old next month. And I also was working on, I'm still actually putting the finishing touches on the book that I've been working on for the last several years. So you'll certainly hear more about that in the new year. And so those are just 2 examples. Actually, there's one other thing I can say. I was on more planes this year than I probably have been in any other year in my life. So I did a lot of traveling this year. So some was for fun, but some was for visiting family, and there's, some things happening behind the scenes. So long story short, lots of stress this year. And so I did have 2 cycles in particular. So 2 cycles in question that were certainly, one cycle was quite a long one. And then one cycle I actually had some spottings, and it was, these 2 situations were very interesting. I'm going to share this because I think it's interesting, and I wasn't planning to, but it's just coming up. And so I'm going to share this, and I think that it'll help with the chart interpretation piece of it. So the long cycle that I had coincided with an extremely stressful time, lots of travel. During the time of my travel, being away from home, my diet was quite a bit different than it normally is. And I would say quite a bit lower in protein than it usually is. And that was just because I was kind of out of my natural environment, let's say. And so in that context, when I was looking at this long cycle, I was able to interpret why. I wasn't surprised by what I saw in the cycle. I wasn't scared. I wasn't shocked. I wasn't really concerned. But again, this comes from experience because for me, it's quite obvious that I was in a situation that's very much outside of my norm. I have a lot of background on how these different types of factors can affect the menstrual cycle. And so when I had this quite long menstrual cycle in the early part of summer, it kind of was like, well, yeah, that makes sense. And then I did have a very, very stressful period of time in the fall where for the first time, I've never had this happen before in 20 years of charting, but I think it was 5 days of light spotting before my period. And literally, I've just never had that happen before. I've seen plenty of charts. I've had plenty of clients that have had this. So it's, if you have experienced this or if you experience this on a pretty consistent basis, like we should talk about that. But again, it was very unusual for me based on what my cycles are normally like. But then when I looked at the situation, it was an extremely, extremely, extremely stressful time where, for better or for worse, my sleep was not happening the way it needed to. There was a lot of stress. A lot of things were going on. I was working a lot and I was traveling a little bit too. And so again, within that context, there was a couple of things. So one of the things I think that is really interesting about it is that in both circumstances, first of all, like I said, I knew why I was seeing these changes. The other thing was that in both situations, it certainly was an important wake-up call. My body was literally telling me that it's too much now. You've pushed me enough, and now my body was kind of throwing a tantrum, like, okay, look, this isn't going to work. And that's actually not the part of the having like a abnormal cycle, but the knowledge part is what I want for all of my clients and practitioners, so that we can get to a point where we can interpret and understand what's happening in our cycles without freaking out and assuming our bodies are broken and everything is totally wrong. And really, you take that as an opportunity to course correct.
Popping into today's episode with an incredible resource to share. Today's episode is brought to you by my top resource for women's health professionals, How to Interpret Virtually Any Chart Your Client Throws at You. Our new ebook breaks down complex chart interpretation into an easy step-by-step process. Head over to fertilityfriday.com/chart to snag your complimentary copy today. That's fertilityfriday.com/chart. Now let's go ahead and jump back into today's episode.
So I can, when I saw that one cycle with the 5 days of spotting before my period, like I said, never happened in my life. A couple things were happening there. One, I knew why it was happening. So there wasn't any kind of question mark as to why. There was a book-related deadline in there. We were finishing up editing to get it to like there was things happening. There was just a lot of things going on. I was doing a program launch for the FAMM Practitioner program. Like there was a lot of things happening. Like I said, I've got my now 18-month-old daughter or 17-month-old daughter and my 2 other sons, they were just starting school. Like, so there's all these things happening and so for me, that was not a surprise, but it was also a reminder that I have limits and that this can't go on, like it can't continue. And so once I got through that period of time and those goals that I was working towards and all the things that I was trying to do, then it was a time for me to course correct. So what's great about this example was that was one cycle and that was me pushing it to the limit. And that was information that I was able to use to then course correct so that I could not have that happen again. And my subsequent cycles, when I was focused on my foundational factors, my eating, my sleep, my supplements, all the things that I usually do, I was able to just kind of get right back into a more normal, for me, parameters in check cycle. And so to kind of get back into, this was an unplanned tangent, but to kind of get back into the point that I wanted to make related to this whole concept of chart interpretation was that it's important to know what's normal versus abnormal, first of all, in a general sense. So what a normal cycle really looks like in general. So I've had clients over the years who'll say, well, this is normal for me, right? However, if your cycles are always 42 days, that might be normal for you, but that doesn't make it normal. So we have to know what is actually normal, what the normal parameters are. And so that includes the overall cycle length, the length of the follicular phase before ovulation, the length of the luteal phase after ovulation, what the period's like, all those kinds of things. We need to know what's normal versus what's not normal. But then when you're working with clients or when you're looking at your own cycles, you also do want to know what's normal for you, because that is a really important piece of the chart interpretation, just general kind of idea. So if I'm working with a client and they come to me and I have one chart, and that one chart is 45 days long. So I'm going to want to know what's typical for them. So to put it into context, why would someone have a 45-day cycle? Well, did they just come off the pill? Is this their first cycle off the pill? Have they been on the pill for 20 years? Because if that's the case, then okay, that makes sense in that situation. If the first cycle is 45 days long, or if it's still kind of going around that time. Or is this somebody who has never been on the pill and their cycles are always like that? They're always long and sometimes irregular. So that's a completely different conversation. Or is this somebody who has recently had a baby? Like in my case, they have let's say their baby boy is under a year old, and this is their second cycle since they had their first period or something like that. So all of those pieces matter, because that same 45-day cycle could look very similar in these different situations, but it could mean something completely different. Whereas in one situation, it could be, although it's not normal to have, like in terms of what would be optimal, it's not normal to have a 45-day cycle by any stretch of the imagination. But in certain situations, we can understand why that's happening. It could be a transition phase. It could be that you're still breastfeeding, and the breastfeeding is pushing back ovulation, because that's one of the impacts that it can have. It can be that, you're still in the post-pill transition phase and everything's normalizing. So there could be reasons, or it could be that you actually have, an issue with metabolism, like in the case of PCOS, and that is what's contributing to the delay in ovulation. Or like in my example, in the summer, it could be that you had somebody who was traveling and who had a pretty significant dietary change during that period of time that then contributed to what was happening, or that the person was running a marathon and that delayed ovulation for a period of time. And then once they stopped training so hard, their cycle resumed normally. Again, we want to know what's normal versus abnormal in the absolute sense. And then we want to know what's normal versus abnormal for them, because that can really help us to interpret the chart in a more factual way. And this is also important because then instead of looking at the chart just for face value, we are taking it and always putting it into the right context. A chart by itself on the beach, it's less helpful to us. If there was just a random chart and I didn't know who it belonged to and I didn't know anything about this person or what was going on, now that's just not ideal. You can't really honestly just draw this whole picture about what's going on in a chart without it being attached to the person, without knowing their age and their history and what's going on. So that's really, really important. One last piece I wanted to talk about today is knowing which factors in general impact the cycle and knowing how certain factors impact the cycle. This is key to chart interpretation. And this is what helps us to put everything into context. So knowing, for example, what factors affect temperatures. I think temperatures are really great. I think they're so helpful in the general sense for chart interpretation. But temperatures are one of the most variable factors when you're looking at the menstrual cycle chart. And to the point that there are some methods of fertility awareness-based charting that actually discourage you from taking the temperature at all. And there is even a few articles out there where they say temperature is unreliable and people shouldn't use it for this reason. So this is a way of saying that there's debate within the fertility awareness community of how useful temperature is. With my experience with the symptothermal method, I have found that the temperature is very, very helpful, especially for women who are newer to charting, especially as a practitioner too, when it really helps to kind of triangulate what's going on to be able to compare the mucus to the temperature. The temperature is kind of like it's a more definitive sign because you have a number on a graph. So it can be just so helpful in that respect. But with that said, there is a lot of fluctuation and variation with temperature. And so whether that's related to sleep disturbances or sleep duration or, whatever that is, whether it's related to incorrect temperature taking, as I would say, if you're not holding the thermometer in place long enough, if you have seasonal allergies or anything else that is triggering your immune system and causing the temperatures to look really erratic, or if you're kind of unaware of some of the factors like drinking alcohol or waking up at different times that could have an effect on your cycle, and even using different devices, because different devices, it's very interesting. There's so many cool devices now, devices on your wrist, on your hand, on your finger, on your arm, right? I'm a fan of the temp drop, and I'm often, promoting that. fertilityfriday.com/temp drop if you wanted a discount on that. But that aside, there's so many different ways to take your temperature. But when you're trying to interpret that on a chart, you have to know how those different methods of taking it can affect it. And you also have to know how different things on the chart can affect it. And that comes before you can effectively interpret the chart, because you can have somebody who shares their temperature chart with you, and you can see that there's all of this stuff going on, and there's these high temperatures or low temperatures or random temperatures or whatever the case is. You're having a hard time identifying if ovulation happened or what's going on. And again, that's where all of this comes in. Like, you have to know what factors affect temperature. And I, of course, would recommend a standardized way of taking it and tracking it. So other factors that you want to be aware of, you want to be aware of how stress impacts the menstrual cycle. You want to know how acute stressors like travel or like work-related stress or situational stress or something like that, or a stressful time in someone's life, you want to know how those things impact the cycle. I would say you also want to know how chronic stress impacts the cycle. I mean, there's a difference between having something happen in a certain situation and for that to really stress you out and for you to see that effect on the cycle that day, versus if you have kind of more of a chronic stressful situation where you have a really difficult job and maybe you have a really long commute, and that kind of thing. So it's not as situational, but it's more all the time. So it is helpful to know how stress can impact the cycle in different ways, how exercise can impact the cycle, how diet can impact the cycle, whether a person's under eating or their macros are imbalanced and it's causing blood sugar problems, that kind of thing. And then, of course, various health conditions. So there's just a lot of different ways that the cycle can be changed and disrupted and etc. And so when you're looking to understand how to interpret what you're seeing, you kind of have to have this knowledge base and then be able to put it all in context and then have your client's chart in a certain way so that it all makes sense. So although I meandered a little bit, I did have an outline. And so to kind of go over the main points that we talked about today, I started by talking about some of the common chart interpretation mistakes. And of course, I believe the biggest one is kind of running in and jumping to conclusions with taking the chart at face value and then trying to make a whole bunch of interpretation comments and things like that from that piece of information, as opposed to taking that as information and then having your client complete what I call a baseline chart to really get into what's going on. I talked about the importance of using a standardized way of tracking so that you can really get on the same page with your clients and to really help you to get more information and to have kind of less. I suppose the best way to say it would just be, when your client is on the same page with you and they're charting in a certain way, it allows you to go much deeper into what's really happening as opposed to kind of spinning your wheels and trying to figure out what they meant by this thing on the chart. And then I went into my personal story and tangent about some of the changes that I saw on my chart at different times in this year. But the key kind of takeaway from that is to really know what's normal versus abnormal in the general sense so that there's just no unicorns. I just don't feel like this particular client is the one client for whom it's normal to have a 60-day cycle, right? So we have to know what's normal versus abnormal in the general sense and where the charts are fitting into that. But then we also need to know what's normal and abnormal for that client. So once you are working with someone, let's say for several months, and you start to see what their patterns are like and what their cycles are typically like. So I can give an example of that. I've had a number of clients who have long, healthy, wonderful luteal phases where their average luteal phase was like 14 or 15 days. So I'm thinking of a few clients where their average regular luteal phase was like 15 days long, pretty consistently. And then there was a cycle where there's stress or where there's something going on, and the luteal phase goes down to 13 days. So for that particular client, I look at that 13-day luteal phase and I say, oh, what was going on there? But I don't do that because, 13-day luteal phase is super healthy. I'm sure that there's plenty of you listening who's like, wow, my luteal phase has never been higher than 11 days. Like 13 days would be awesome. And in the same exact way, if I was working with you and you came to me with a history of having luteal phases that were 9 or 10 or 11 days and we got it up to 13, like we would be air high-fiving, but in the computer screen. And again, this goes back to knowing what's normal and abnormal in the general sense, and also knowing what's normal or abnormal for you and making that distinction. And then the last thing I said was, or the last point that I was making today, was knowing which factors impact the cycle. This is a huge part of chart interpretation, because without kind of having that base of knowledge of what can be affecting the cycle, we can really be led in a ton of different directions. Whenever we see something that we don't anticipate on the chart or is different to what we would normally see or think we should see, then we can kind of jump to some sort of, oh my gosh, what's going on? As opposed to thinking about the different factors that could affect it. And so I think what I'll end by saying is that there is a difference between some of these fluctuations that happen situationally. So when you have a situation like the example that I gave for myself, where there was something that was going on and the cycle was kind of weird, but the cycle didn't continue to be weird after that. There was a weird cycle. It was directly related to something that was going on. And then after the thing wasn't going on anymore, the cycle actually resumed to what is quite typical or quite normal. And so this is also like a huge takeaway from chart interpretation. So chart interpretation 101 being that when you're trying to identify if there's an underlying health issue or if there's something going on, we want to know the difference between that kind of one-off scenario where you have that one cycle where something's kind of off and we can tie it into something maybe that was going on for you, versus the person who has the chronic issue, whatever it is, all the time. So there's a difference between having a couple days of spotting that one time because your sister was getting married and your dog was sick and whatever. And that was kind of one of the only times you had that this year, and the rest of the cycles are fairly typical, versus the person who's always having that mid-cycle bleeding or always having that bleeding after intercourse or always whatever, So those are important distinctions to make when you're looking to increase your skill in chart interpretation. So I hope that you enjoyed today's episode. Like I said, if you are loving this topic and wanting to dive deeper into it, absolutely grab a copy of our new ebook, How to Interpret Virtually Any Chart That Your Client Throws at You. You're going to love it. fertilityfriday.com/chart. We shared a bunch of really interesting and specific examples, and we went through step-by-step of what we teach actually our FAMM practitioners in terms of how to interpret charts. So I think it'll be an extremely valuable resource for you. Again, fertilityfriday.com/chart. If you found today's episode helpful and you can think of someone who you know would love it, then make sure to share. It's fertilityfriday.com/501. And I'm still in awe that we hit 500, episode 500. And this is the 501st. And so it was just my pleasure to record this episode today and to share some tips and interesting tidbits of information that I found helpful over the years to help me interpret charts. And like I said, I didn't plan to share my own experience with my cycles this year. I think often I don't have anything interesting to share related to my own cycles, but I think the key takeaway there is that for me, the goal with my clients is to get them to the point where they're not freaked out when they see changes in their cycle, but they're empowered to understand what's happening and why, and to know what to do about it, right? I feel like that is this really awesome sweet spot that if we can get there, I think life is a little bit different. We can have this confidence and deep understanding about what's happening in our cycles. And that's very different from the experiences many of us have had, going through school and not being taught anything about our cycles and not knowing what's going on, versus being so empowered that when we see a different shift or fluctuation in our cycle, we can actually know what it means and take that as information, like our body's telling us, okay, peel back a little bit or whatever it is. So I'm going to leave it there. I hope you have a wonderful weekend whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting. And that's a wrap. If you're loving the Fertility Friday podcast, then I know you'll love FAMM, our Fertility Awareness Mastery Mentorship Certification Program. It's a 9-month program designed to teach you how to use the menstrual cycle as a diagnostic tool in your women's health practice. The menstrual cycle is the missing piece you've been looking for to better support your clients to balance hormones, normalize their cycles, and optimize their fertility. When you join FAMM, I pull back the curtain and share advanced chart interpretation strategies and specialized client protocols that will completely transform your practice. Enrollment for FAMM is opening up again in a few months. Head over to fertilityfriday.com/FAMMlive to join the waiting list and be the first to know when early bird registration opens. That's fertilityfriday.com/FAMMlive.